Hey, future counselor, it's study time. Welcome to Group Counseling Exam Questions. Many, if not all, treatment and addiction programs have some type of group counseling as a way for the clients to be able to share their experiences and to see other people who are in similar situations. You will be asked group counseling questions on your addiction exam. It's a large part of recovery for those who we are supporting. So let's get you ready and prepared to pass. In this video, we're going to focus on how to answer group counseling exam questions with confidence. You'll learn the key concepts that come up most often, like group stages, counselor roles, and managing group dynamics. We'll also look at how each question is worded so we have an idea how to answer each question by applying the knowledge we know. We'll also get clear explanations of both correct and incorrect answers. And lastly, we'll learn how to think critically so we're thinking like a counselor and not just a test taker. There are 5 key things to remember when we talk about group counseling. 1, the purpose of the group. Groups help clients learn, connect, and heal together. 2, that dynamics are of the most importance. Every group has roles, stages, and energy that impact progress. Also, safety is always first. It's important for us as counselors to remind them to maintain confidentiality and also to set clear boundaries. Next, we, as the facilitator, are responsible for guiding, not dominating the group, but also encouraging them to share and provide feedback and support to each other. And lastly, the group is always going to be growth focused. We use reflection, coping skills training and practice, and share experiences to promote change and to enhance recovery. Let's get started on our exam practice questions. 1, which of the following is the main goal of group counseling and addiction treatment? A, to replace individual counseling. B, to provide peer learning, accountability, and emotional support. C, to focus solely on relapse prevention. Or D, to diagnose mental health disorders. The correct answer is B, to provide peer learning, accountability, and emotional support. Group counseling develops peer connection, shared learning, and accountability. It would not be A because group counseling doesn't replace individual counseling. It complements it. As a matter of fact, many people in addiction recovery often have group, family, and individual counseling. It would not be C because relapse prevention is a part of it, but not the main goal. And it would not be D because diagnosis is not a group counseling function. In the early stage of group development, the counselor's primary role is to A, confront resistance immediately. B, allow clients to lead sessions freely. C, establish trust, structure, and safety. Or D, focus on relapse triggers. The correct answer is C, establish trust, structure, and safety. Early stages are about building safety and structure. It will not be A because confrontation too early can break trust. It will not be B because too little structure causes confusion. And it would not be D because relapse work happens later after support forms. Question 3, during group counseling, a member dominates every discussion. The counselor should first A, ask the client to leave the group. B, redirect gently and encourage others. C, ignore it and continue. Or D, confront the client harshly. The correct answer is B, redirect gently and encourage others to share. Redirecting respectfully maintains group safety and inclusion. It will not be A because dismissal is extreme unless it's ongoing and harmful. It will not be C because ignoring allows the pattern to continue. And it will not be D because being harsh when confronting someone damages rapport. Question 4, confidentiality in group counseling means A, the counselor must keep client information private. B, group members are legally bound to confidentiality. C, everything discussed can be shared outside of the group. Or D, counselors can record sessions without consent. The correct answer is A, the counselor must keep client information private. The counselor is legally bound to protect confidentiality. It would not be B because members are ethically expected to maintain confidentiality, but not legally bound. And it would not be C or D because they both violate confidentiality. When you're facilitating groups, it's important to remind members that confidentiality keeps the space safe and to remind them that it doesn't work if people don't feel like their information is kept confidential. Question 5, Which type of group focuses on teaching specific coping or recovery skills? A, process group, B, psychoeducational group, C, support group, or D, encounter group? The correct answer is B, psychoeducational group. Psychoeducational groups teach structure, skills, or information. It would not be A because process groups focus on emotions and interactions. It would not be C because support groups are peer-led and not skill-based. And it will not be D because encounter groups are confrontational and they are not typically seen in addiction treatment groups. Question 6. Which group stage involves open conflict and testing the leader's authority? A, forming, B, storming, C, norming, or D, performing? The correct answer is B, storming. In the storming stage, the group experiences tension and power struggles. It will not be A because in the forming stage, that's more of orientation, getting to know each other. It will not be C because the norming stage, often we see cohesion in the group coming together. And it will not be D because the performance stage, we see productivity and trust. Question 7. A client shares about a recent relapse in group. What's the counselor's best response? A, ask why they relapsed. B, shame them for not following the plan. C, validate honesty and invite group reflection. Or D, ignore the comment and move on. The correct answer is C, validate honesty and invite group reflection. Validation and discussion reduces shame and models accountability. It will not be A because why questions can feel like we're accusing them or something. It will not be B because shaming discourages openness. And it will not be D because ignoring misses a key learning moment in the group. Question 8. Which of the following demonstrates appropriate counselor self-disclosure in groups? A, sharing personal trauma to build connection. B, using a brief personal example to normalize a client's experience. C, talking about one's own recovery journey in detail. Or D, avoiding all self-disclosure. The correct answer is B, using a brief personal example to normalize a client's experience. Limited self-disclosure can model authenticity. It will not be A or C because oversharing can push the boundaries, and it will not be D because not sharing at all can seem cold and distant. Question 9. What's a potential advantage of group counseling over individual counseling? A, it eliminates the need for case management. B, it's less time consuming for clients. C, it offers peer feedback and shared learning. Or D, it's more confidential. The correct answer is C. It offers peer feedback and shared learning. Peer interaction builds insight and accountability. It will not be A or B because group doesn't replace other services. And it will not be D because group has less confidentiality, not more. Question 10. When should the counselor intervene in group conflict? A, only if physical harm is possible. B, immediately to maintain group safety and respect. C, never. Conflict is a part of the process. Or D, after the session privately. The correct answer is B, immediately to maintain group safety and respect. Timely intervention models healthy conflict resolution. It will not be A because you don't want to wait until risk escalates. It will not be C because unmanaged conflict damages trust. And it will not be D because addressing it privately loses the learning opportunity for the group. Remember to subscribe to the channel and hit that bell so you can consistently receive new study presentations to support you in passing your addiction exam.